the project that we're presenting is our work on the use and implementation of ketogenic diet to enhance the function of CAR T-cell therapy. And so this research is going to be presented as a plenary session by my colleague Dr. Liu here. And as a high-level overview of the project, most current strategies to enhance the function of CAR T typically looks at genetic engineering and genetic modulation, so either overexpressing genes or knocking out genes. We ask the broad question, how do lifestyle factors play a role in the response to CAR T therapy? And so we asked the question, how can diet possibly modulate the function of CAR T therapy? And found that a ketogenic diet in preclinical models enhanced CAR T anti-tumor function. We took it a step further by looking at which metabolites were enriched within the circulation when mice were fed a ketogenic diet, and found one particular metabolite called β-hydroxybutyrate to be particularly elevated in mouse models. And so our theory and our hypothesis is that β-hydroxybutyrate is an efficient fuel source for CAR T cells. So if CAR T cells are given a choice when they're actively fighting tumors between glucose and beta-hydroxybutyrate, our hypothesis is that CAR T cells prefer beta-hydroxybutyrate as a fuel and energy source. We show that administering beta-hydroxybutyrate across different preclinical cancer models enhances the anti-tumor function of CAR T cells, and we even took it a step further and show that administering beta-hydroxybutyrate to healthy volunteers increases peripheral T cell mitochondrial respiration and mitochondrial function. So overall, the theory is that beta-hydroxybutyrate, or BHB, is an efficient fuel source for CAR T cells actively fighting tumors.
The most exciting part of our study is we not only find that the dietary intervention can affect the CAR T cell immunotherapy, but we also found providing this BHB through the oral supplementation, which is a easier way to maintain compared to changing the diet, can affect the CAR T cell immunotherapy. This is very exciting work, and we already initiate a proof of concept trial involving about 5 patients to test the feasibility and the tolerance of using this BHB drink in the CAR-T19 patients, and also assess how the BHB can affect their immune system. So it's very exciting.
Historically, we know that the majority of CAR T patients don't experience long-term remission. We know that there's a significant portion of patients that relapse following CAR T. Furthermore, we also know that historically, solid tumors have been unresponsive to CAR T. We actually have preclinical data suggesting that the ketogenic diet-derived metabolite, beta-hydroxybutyrate, can enhance CAR T in the setting of solid tumors. So this could be a potentially new strategy to treat solid cancers. And from a patient perspective, just like Dr. Liu mentioned, this is a feasible approach to administer to patients. It gives them decision-making capability of their own treatment. It's not really reinventing the wheel. We're offering a supplement that we believe is a better fuel source for these CAR T cells, and we think that the administration of a beta-hydroxybutyrate supplement would lead to, or would allow for higher patient compliance than being on a pure ketogenic diet.